They did a great job.
Yeah.
In accordance with Ohio Revised Code Section 121-22, I hereby call the March 1, 2022 special meeting of the Bexley Board of Education to order. Kyle, will you call the roll, please?
Dr. Baker,
Present.
Dr. Jade,
Present.
Ms. Mitchell,
Here.
Ms. Pickrell,
Here.
Ms. Powers.
Here. Thank you. We are going to invite public participation this evening as we work to ensure that our public participation section is responsive to our community's needs, as well as to the needs of the board to conduct business in an orderly and efficient manner. We ask that those wishing to speak at public comment sign in at the podium at the beginning of the meeting. Is there anybody here who would like to speak who hasn't already signed in on the sign-in sheet? Great, okay. Would you please pull the sheet? Thank you, Kyle. Thanks so much. And then we start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. This is a single topic special meeting. May I have a motion to approve our agenda?
So moved.
Second?
Second.
Thank you. Are there any changes or questions or comments about the agenda as presented? Okay, all in favor, please signify by saying aye.
Aye. Aye.
Aye.
Any opposed? Thank you. That motion carries. Dr. Fine, I'm going to turn it over to you.
Thank you. I want to thank everyone for your patience as our governance team continues to monitor the COVID-19 situation. I would also like to thank the COVID-19 watch team for their expertise and tireless efforts during this time. We continue to work with these members as well as local health officials on recommendations and trends. Additionally, I've connected multiple times with Joe Mazzola, Franklin County Public Health Commissioner, and he reiterates his appreciation for the Bexley community during this pandemic. And he feels our community, schools, and students have made positive choices to protect our community and keep students in school, and have put ourselves in the position to look at next steps. I also appreciate the Central Ohio Superintendents Association for providing me with weekly and sometimes daily access to local superintendents to discuss the impact of going mask optional in other districts and the logistics for doing so. These conversations have been very helpful as we consider the next steps for Bexley. Additionally, I would like to thank Mayor Ben Kessler for your collaboration as we discuss the needs of our city and the larger community. Lastly, I would like to thank our Bexley Education Union President, Mark Frank, and our Student Council President and Board Representative, Quinn Hall. Also, Jessica Scheip, our Ohio Association of Public Schools Employee President, for spending time with me recently to discuss the impact of masking on our students and staff members. I'm so appreciative of our students, faculty, and staff, including our administrative team, substitute teachers, maintenance and custodial teams, nurses, and everyone who selflessly showed up each day and continued energy and effort during these challenging times. I'm thrilled to report that we continue to see many positive trends in our data, especially as it pertains to our student and staff absences. Additionally, we have received new CDC guidance over the past week, which places our community at a medium level of risk. As a result, I will be presenting to the board my recommendation to move to mask optional environment for the board's consideration and a vote tonight instead of waiting for the March 9th meeting. I acknowledge and understand that our community is very engaged around this conversation, and I'm reminded of this each time I open up my email communications. Regardless of where we land on this issue, I think it is vital that we continue to model respect, civility, and grace as we move forward for our students, our staff, and our community. This is not a new expectation, but it is certainly newly important. It has been our shared priority as reflected in the district's commitment plan that we collectively ensure that each student feels valued, seen, and heard. We remain committed to ensuring an inclusive environment that respects the individual needs of our students and families. While I am proposing masks become optional, kindness, empathy, and compassion are still required, and we will expect all students, staff, and visitors to be respectful in our school settings. Masks are obviously the topic of conversation tonight, but how we treat one another and respond to discourse can have detrimental impacts on the mental health and well-being of our school community. I encourage all of our families to have conversations at home around each community member's responsibility of respectful action, regardless of the decision to be made on the topic tonight. Wherever we land, the default in our schools must be kindness and empathy. Dr. Harley Williams, our Director of Facilities and Operations, will start us off this evening with a presentation that will share promising data trends we are seeing, as well as steps we will take if the decision is made to no longer require masks. After Harley concludes, I will reiterate my proposed resolution, and then we will allow time for public participation, followed by time for our board members to discuss and consider the proposed resolution. We're very thankful for Dr. Williams as he has helped prepare tonight's presentation. Thank you.
Thank you, Dr. Fine, and thank you for the opportunity to present this evening. The following slides will demonstrate the data points that the administration used in drafting the resolution that's before you today. The board vote will obviously occur, and we think we're at a good time for this resolution to be placed in front of you. You'll see local data points in the slides that I'm about to share that point to a true trajectory and a positive trajectory that's moving in a steep and positive direction. Some key things I like to start off with before we get into the slides is that some key things have happened just in the last week that also I think support our move in this direction, at least for the resolution. The city of Bexley lifted its mask mandate on February 22nd. On February 25th, the Centers for Disease and Control and Prevention updated its framework to monitor levels of COVID-19 in communities. This framework moves beyond case rates and test positivity to evaluate factors that reflect the severity of disease, including hospitalizations and hospital capacity. Also, last night, the Franklin County Public Health Department rescinded its universal masking advisory. Based on this new framework, CDC has determined the risk in Franklin County to be yellow. The state health department has adopted this new framework as the standard here in Ohio, and as such, Franklin County Public Health rescinded its universal mask order, as I said earlier. As we look at the next slide, we're going to look at some case data, and again, what I want you to focus on are the trends, not so much the data points. It's obviously our sample size is small, at a little over 13,000. But you can see the graph here shows the number of cases in each week in Bexley in 2022. These are our community cases. They're not only cases among Bexley City School District students and staff. And you can see through the middle of January and then the declines since the peak. Now I'm sharing the cases among Bexley City School District students and staff. These numbers are also trending in a very positive direction. We also look at vaccination rate in 43209, and that's 43209 broadly. That's counting Bexley and its surrounding communities. Bexley proper makes up about half of the 43209 zip codes. But 71% of all residents have been vaccinated, including 55% of 5 to 11-year-olds. Vaccination is somewhat higher in the older kids, with 80% of 12 to 14-year-olds being vaccinated and 71% of 15 to 17-year-olds. And again, Bexley residents make up about half of 43209. This slide here, we can't get vaccination rates by age for Bexley proper. However, Franklin County Public Health has informed me that we have approximately 89% of Bexley residents, including all age groups, have been vaccinated. And that's equivalent to 11,099 people. With current high levels of vaccination and high levels of population immunity from both vaccinations and infections, the risk of medically significant disease, hospitalization, and death from COVID-19 is greatly reduced for most people. At the same time, the CD recognized that some people and communities, such as those who are immune compromised and people with disabilities, are still at a higher risk for serious illness and face challenging decisions navigating the world with COVID-19. For those who are high risk for serious illness, the CDC recommends those individuals contact their health care providers to discuss additional precautions. I also encourage those families to reach out to the school nurse or principal to discuss reasonable precautions as well. We know this transition will create anxiety for some of our population. And we just want to make sure that it's known that we are here to help set up precautions, keep everyone safe. The new guidance announced by the Center for Disease and Control and Prevention outlined a new set of measures for communities where COVID-19 is easing its grip, with less of a focus on positive test results and more on what's happening at hospitals. The CDC also advised local health officials and individuals to consider current information about COVID-19 hospitalizations in the community, as well as potential for strain on the local health system and the COVID-19 cases in the community when making decisions about community prevention strategies and individual behaviors. The CDC guidelines for indoor spaces aren't binding, meaning cities and institutions, even areas of low risk, may set their own rules. And the agency says that people with COVID-19 symptoms or who test positive should not stop wearing masks. Briefly, the CDC package of 3 metrics for every county in the United States. 1, new COVID-19 hospital admissions over the previous week. 2, percentage of hospital beds occupied by COVID patients. And 3 new cases per 100,000 people over the previous week. Then they corresponded these metrics to categories: low, which is colored green; medium, which is colored yellow; and high, which is colored orange. The CDC then mapped these metrics into behaviors like masking. So for example, if a county is in the orange, everyone needs to mask indoors. If a county is in the yellow, then only high-risk individuals should mask. The CDC provided a live map that displays the color of every county in the United States. It will be updated weekly. Today, about 70% of the counties are in yellow or green. In other words, about 70% of the counties don't need to mask indoors. Generally, wearing a mask indoors is not required in locations in the yellow zone, and Franklin County is now in the yellow zone. CDC advised that people with increased risk should speak to their healthcare provider about wearing a mask. So what will be the same and what will be different if we move to a mask optional environment? In order to balance individual and community responsibility, we will keep in place guidelines for mask use specific to quarantine, which I'll detail later. For asymptomatic individuals, the use of mask is a personal choice, and individuals will be free to choose whether or not to wear one as it benefits their health circumstances. The district will provide KN95 masks to staff members and to Bexley City School District families when requested. In addition, for students who wish to end their isolation period after day 5, they are still required to wear a mask on days 6 to 10 as per public health orders. They are not required to wear the KN95 mask that we will provide, but they must wear a mask that provides a good fit, closely fitting around the face without gaps along the edges and around the nose, and be comfortable enough when worn properly, covering their mouth and their nose, so that you're able to keep it properly worn. Teachers will not be required to closely monitor those who are required to wear their mask as part of their return from isolation or mask to stay. However, if a student discovers to be in violation of this directive to properly wear a mask, discipline and or removal from school may occur. Mask wearing. CDC guidance does not differentiate as far as whether there should be in some classes or other classes. So we are recommending in our resolution that it's applied universally. We do believe it's now safe based on all of our guidance and the slides, hopefully that they're sharing with you today. And that would include both our co-curricular and extracurricular activities. Some things we have to operate will be a same, something that will not change is our test to play and spring sports. We'll still have a theater program running and mask to stay options. And so let's start with test to play. We went through test to play in a winter season, and we learned lessons along the way, and guidance changed along the way, and we're waiting to see what happens as far as guidance, if there's going to be guidance changes. So test to play, for those who might not know, only applies to our athletes. And as you know, our spring sports are all outdoors where the risk of spread is lowered. We've asked our local public health officials if this guidance will be modified for outdoor sports. They are looking into this, and as it's currently written, spring sports team members who are identified as a close contact shall either safely wear a mask for 10 days from the day of their exposure, or test upon initial notification and test again on day 5 from the last. It's recommended to test on day 5 from the date of last exposure. In conversations with our watch team, it's universally agreed upon by the medical professionals on our watch team that it really only makes sense for us to test symptomatic athletes and question the use of test kits on athletes who are exposed while outdoors. Once this decision is final, it will be communicated to our families of athletes who are involved in spring sports. And as far as a theater program, whose basically their season is about a 3-day long, I mean, there's practice, but the performance part of their seasons is 3 days long. But how we'll manage them is symptomatic thespians will be required to test and receive a negative result in order to participate in that day's performance or rehearsal. Asymptomatic thespians identified as a close contact will be required to wear a mask in order to participate in that day's performance. Asymptomatic thespians who were exposed will not be required to test. We feel that keeps all the work and keeps kids safe, but still keeps the performance occurring. As far as masks to stay, all asymptomatic students identified as a household or close contact can attend school as long as they properly wear a mask throughout the school day for 10 days from the day of their last exposure, and while they're monitoring for symptoms. And they should isolate if they become symptomatic. And once a close contact or positive student has been identified, we will communicate with them to share masking requirements, effective timelines, and offer KN95 masks. A mask must be able to be worn in order to return to school, but it does not necessarily need to be a KN95. We recognize that some students are unable to wear a mask because of medical conditions or developmental disabilities, as recognized by their medical provider. In these instances, we will work with Franklin County Public Health to determine if there's a safe way of allowing these students to remain in the school setting. I want to emphasize that when it's this determination, that level of risk and the safety of health of other students and staff will certainly be considered. What's another thing it's the same as the Ohio Department of Health isolation guidance. Those who test positive for COVID-19 must self-isolate at home for 5 days. After day 5, those who are fever-free for 24 hours and have improved symptoms may return to school and wear a mask through day 10. If they cannot consistently correctly wear a mask, individuals should continue to isolate at home for a full 10 days and return to school on day 11. What's different? We got new guidance that was issued on 2/25. The CDC does not require a mask on buses or vans operated by the public or private school systems, including healthcare and in our childcare, early childcare, and our after-school programs. And so, if this resolution is passed on March 4th, masking will also be optional in our district-owned and contracted transportation. Same thing, we're not changing lunch. Lunch will look the same as it does today if this resolution is passed. Students will still be reminded, encouraged to eat within 3 feet of distancing Students who are returning from isolation, attending school as per mask stay guidance will be reminded and encouraged to eat on mask with 6 feet of spacing between them and their peers. These will be minimum standards, and principals will have the discretion on how best to implement these expectations in their buildings. As you know, each building has its own unique situations and variables that have to be addressed. Something else that won't change if the resolution is passed is our communication with families. The online COVID reporting form still will be used and encouraged to be used. It's found on top of our Bexley Schools webpage. We will continue to notify families via email as required by public health every time there's a positive case in a classroom or school. Bexley will update its dashboard weekly as required by public health officials. And our nurses will be in contact with families who report a positive case. Other things that will stay the same if this resolution is passed are ventilation. We've recently had a test done on air quality. Found the results to be excellent. MER filters we talked about earlier are working. We had to increase some airflow, outside airflow, and a couple air handlers. But even the parts per million results were well within normal range. But we did adjust a few things to create airflow from outside back into our school. But that shows you we were just paying attention to those types of things. Again, social distancing. Test kits now are no longer a worry as far as availability. We've got plenty of test kits, so now we're able to open that back up to parents in the community if they would need a test kit. They contact the school nurse, myself. We can make sure we can get you a test kit. And again, our cleaning protocols are always enhanced during flu season anyway, and we're following our flu season cleaning protocols. We'll still follow those protocols throughout the pandemic. And hand sanitizers, we have stockpiles of sanitizers that were donated from businesses and hospitals around here. So you'll continue to see them in the building as well. What's different is there's going to be have to pay attention to people and support people that are high risk for severe illness. Masks to stay obviously kept everyone with help protect those people a little bit more than a mask optional environment will. How we're managing that internally is that staff would have concerns about the shift to mask should contact their building principal or human resource officer. What we're putting together bullet points for conversations with our staff. They will be instructed not to make recommendations on mask wearing in their classroom to their students. We feel, and there's in the guidance, it'll say that, storytelling and sometimes like that, if you had a severe illness, you might want to share that story, and people around you might say, yeah, I'll help you out. I don't mind wearing a mask, even though I prefer not to. We might have those conversations with students, of the students that are old enough to handle those students, but it won't be the teacher. We'll have some administrators in there too, because we want to make sure that we're not being accused of I don't want the teachers accused of leading, influencing, coercing, or anything like that by telling a story. And so that's the direction we're going to give our staff. And the direction I like to have the community as they hear this is that I know that this is going to create some anxiety for some families that have someone who's at risk for severe illness in their household. As he said, CDC should talk to their guidance, their healthcare providers about what kind of precautions they can add to that. And I'm also going to reiterate again, come talk to the school. We support students with safety plans all the time, with allergies and things like that. And we will follow that same process and try to work with the families to create reasonable accommodations so that the child can feel safe in school. And the same is our emphasis and efforts towards social and emotional well-being. We would remain committed to ensure that an inclusive environment respects the individual needs of our students and families, that no person shall be subject to discipline, harassment, or other mistreatment for choosing to voluntarily wear a mask or for not wearing a mask. And then same as following up with our social emotional well-being. And we're focusing our work with school counselors right now. Ms. Abraham has done a nice job getting coordination and communication out to counselors, so they're prepared for this move should we have this resolution passed tonight. And that school counselors will make classroom and small group and individual connection with students support their mental health needs, as well as every transition, faculty, staff, exercise, increased vigilance, and student behavior and mental health shifts. We are listening and watching, and will continue to support students and families through each transition. So I'm not assuming the outcome of tonight's vote tonight, but I feel it's an appropriate place to express my gratitude publicly for all the support I have seen and received personally. I'm appreciative of all the collective efforts that have allowed us to arrive at this place together. Thank you to our past and present Board of Education members for your guidance and support. I'd like to thank our students, our staff and families and community for maintaining healthy habits over the last 2 years and have been our partners and allies in keeping as many people safe as we possibly can. The feedback and resources we received from those who were strongly opposed to masking certainly was appreciated, as well as it challenged our thinking and helped us grow as well. I'd also give a very special and heartfelt thank you to our health service team, Cindy Tyson, Terry Grace, Amy Poling, Chandler Hurst, and Sarah Prater. Their work was incredible, and the demands placed upon them in this time was incredible. They were just simply, they were tireless and they were amazing throughout this pandemic. I'd also like to recognize our watch team, Dr. Mary Lynn Nyland, Dr. Abby Norris Turner, Dr. Ben Amasu, Dr. Allison Norris, Dr. James McDonald, and Dr. Ted Brasky for generously sharing their time and expertise with our district leadership. Their support is appreciated more than I can possibly express here tonight. And with that said, my presentation is concluded. Thank you again for the opportunity to share this with you and the community.
Thank you so much, Dr. Klein, and Dr. Williams for that. It's really helpful, thoughtful presentation that helps us to understand. Thank you. Understand the proposal, the recommendation that's being made tonight. Do you want to make more comments now?
Yeah, please. Thank you, Dr. Williams, for your tireless efforts as well. Based on the information that you saw in front of you, you have the draft resolution in front of you. This recommends to the board to rescind the November 9th, 2021 amended universal mask resolution and no longer requires masking during the school day for all Bexley students, staff, and visitors. I'm going to ask Mr. Pettit, he's going to help guide some of the visuals for you that demonstrate the resolution, but it should be noted as Dr. Williams shared that there are still times when masking will still be required, which was mentioned earlier, that is in your resolution. That is when students and staff return to school after a COVID positive absence or being identified as a close contact. All extracurricular activities, as you heard earlier, will be held in accordance with the test to play option. The Ohio Department of Health's COVID-19 self-isolation and masking guidance for individuals who have tested positive for COVID-19, OHSAA, and other industry standard guidelines as determined by the superintendent. And lastly, the resolution includes supports for this transition to district's expectations that will honor individual masking decisions and that no person shall be subject to discipline, harassment, or other mistreatment for choosing to voluntarily wear a mask or for not wearing a mask where such use is either not required or an exception applies. My draft proposal states for the change to go into effect on March 4th, giving our faculty and staff, students and families time to process the change, discuss personal choices, and ensure that all of our students are prepared. I recognize that this would represent a change to the way we have all functioned over the past 2 years. We have learned a lot throughout the journey, and I'm optimistic about the opportunity to ease restrictions that were necessary during the peak of the pandemic. Our number one priority was to ensure the safety of our students and staff and to provide a world-class in-person learning experience, and I'm proud to say that we have done that. As Bexley has proven throughout this pandemic, we are committed to continuing to monitor trends and shifts in the data, and we will update our guidance as necessary. At this time, if there are no immediate questions, I believe we are ready for public participation, which will occur before the board discusses the resolution at hand.
I think what we're going to do is have public participation first and then go back to ask questions and such. So the board welcomes public comment tonight. It's our opportunity to hear from the community. We encourage your participation within certain parameters. When you come to the microphone, please state your name and your address. Our policy requires that you limit your comments to 5 minutes. Public participation is an opportunity to be heard, but it is not a question and answer session with the board. As the president, I'm responsible for the orderly conduct of the meeting and the appropriateness of the subject being presented. Our public participation policy allots 5 minutes to each person who wish to speak until a total of 30 minutes is used. I believe we're using a visible timer tonight, so there'll be a 5-minute clock, I think, that will show up. Because there may be more people here than could use 5 minutes and 30 minutes would be expended. If you're able to make your comments in fewer than 5 minutes, you're more than welcome to do that. If you need the 5 minutes, that's fine too. If we get to the 30-minute mark and there remain community members who have signed up but have not yet had an opportunity to speak, then the period of public participation may be extended by a vote of the majority of the board. I will entertain a motion for that extension when we get to that point, if we need to. That decision is completely at the discretion of the board at each meeting. Kyle, I am ready to roll if you are.
First name is Catherine Darrow.
You can slide it. It might slide if you want. Up to you.
I have a loud voice. I'm Catherine Salandero. I'm at 124 South Remington Road. And over the past 2 years, my 3 children have been negatively impacted by this administration's COVID policies in the following ways. They've been denied access to education. They've been forced to submit to medical testing without parental consent. They've been forced to wear a medical device without parental consent. They've been forced by their teachers and principals to isolate from their peers and reprimanded for socializing with their friends during their free time and on non-school days. They have suffered from increased social anxiety. They have been subjected to increased screen time. They experience inconsistencies in the manner in which rules are enforced, leading to confusion and anxiety. They experience difficulty with vision due to fogging of glasses and difficulty with hearing due to muffling of voices. They have increased school-related anxiety, leading to an increased need for mental health-related school absences. Their trust in their teachers, principals, and administrators has exponentially decreased as they see policies inconsistently applied, punishments inflicted for minor infractions, and teachers publicly criticizing their normal behavior. Certain medical conditions have been exacerbated due to mask wearing. Documentation of this from medical doctors was provided to Mr. Williams, but in his medical expertise as a non-healthcare professional, he denied any exemptions based on medical information. My children have been maliciously and specifically targeted by their teachers for punishment based on benign carelessness related to mask wearing, as opposed to willful misconduct. Throughout the past 2 years that these policies have been enforced, my children have suffered. The children of our community have suffered, and we have parents have suffered. My husband and I have repeatedly shared our concerns and issues with this administration. We have directly informed the superintendent and the principals of our children's schools that we do not consent to the forced masking of our children, to isolation or distance from their peers, to forced absenteeism from school, or forced medical testing. The response of this administration from the superintendent to the board members has been sorely lacking in any consideration for the social, emotional, or physical development of children, let alone any basic consideration for the civil rights of parents to make health and medical decisions for their minor children. In fact, for the most part, with the exception of Dr. Baker, this board has dispensed with simple civility, with only the barest acknowledgement of emails without any substantive engagement with the issues. Instead, the superintendent has threatened to call the police on me for watching my children in a band concert while 60 children stood up with a hole in the center of their mask. Instead, the school boots my completely healthy, asymptomatic child out of school for over a week with no academic plan for how to educate him during that time. Instead, the middle school principal responds to issues by prioritizing other children's anxiety over my own child's anxiety. And again, Mr. Williams denies mask exemption requests supported by medical documentation, prolonging the traumatic impact of this administration's atrocious policies. Mr. Fine, this board and you have willfully and immorally closed your eyes to the reality of a child's life lived in this small community of Bexley. Every day in our town, children play together in each other's homes unmasked. They have done so for the entirety of this pandemic. They mix together in groups large and small. They have sleepovers. They play contact sports. They hug each other. They high five each other, all completely unmasked. This is the way children and all humans develop social and emotional bonds with one another. It's how we connect, it's how we develop empathy, and it's how we recognize our similarities even when we have differences. But when children return to school on Monday morning, they are separated and muzzled. They are scolded and punished if their faces are seen. They are distanced from their peers and sent to eat lunch on the floor. Pretending that masks protect them or anyone else is a denial of the lived experience of the majority of Bexley school children. It is well past time to say goodbye to these burdensome policies. Our leaders have already shown that they lack the ability to lead, so it is time to follow. Time to follow Grandview and Gahanna and Hilliard and Upper Arlington and Southwest and Dublin and CSG and Academy and Reynoldsburg and Tays Valley and Big Walnut and Buckeye Valley and Hamilton Local and Licking Heights and Olentangy and Pickerington and Washington Courthouse and Westerville. These districts have found a way to give parents and children a choice. Maybe we can be bold enough to follow what these other districts have proven to be possible, since this board lacks the vision to lead. It is well past time to end mask policies, social distancing charades, targeted and discriminatory punishments, and COVID reporting. There is no return to this farce. There is no on-ramp. This is the end. Enough.
On behalf of the board, I appreciate your coming in to share your comments with us. Kyle.
Ted Cahill.
Board, Dr. Fun. Ted Cahill, 182 South Dawson. I have 3 children in Bexley schools currently. I'm here this evening to speak out in support of a masking policy explicitly tied to the current CDC guidelines promulgated on February 25th. Dr. Williams walked through a lot of my presentation, and I know that there are a lot of people here who have things to say, so I'm going to try to edit it and make it a little shorter. As we entered the pandemic together in March of 2020, our school board took on the task of sorting through public opinion, local medical and epidemiological information as in an ever-changing landscape of federal guidance with respect to preventative measures around COVID-19, all of which were aimed squarely at preventing transmission of the novel coronavirus. In doing so, the board weighed a number of potentially conflicting goals, ultimately settling on a science and data-based policy that sought to ensure staff and student safety, along with that of extended family members here in our community. That policy took into account factors including the number and location of cases, as well as information about the transmissibility of the virus, and most importantly, access to safe and effective vaccines. As vaccination rates and access to inexpensive and relatively accurate home testing increased, the board and school administrators adjusted policies to rebalance risk versus known data points. This resulted in decisions allowing a mask optional policy for certain extracurriculars based on explicit guidance from the CDC concerning masking and outdoor activities. Had local cases continued a downward trend in fall of 2021, I believe that a loosening of mask requirements both locally and in our schools would have been supported by the CDC and other health agencies. However, the appearance of a highly contagious variant Omicron changed that and delayed any such response. Now, many months after the Omicron surge, the CDC once again has issued guidance on prevention, this time at the county level. Under the CDC's new guidance, which uses the stoplight system Dr. Williams described, Franklin County is at yellow or medium risk. Recommended prevention activities for medium risk from the CDC's website include staying up to date with COVID vaccines, testing if you're symptomatic, and masking or taking other precautions if you are at risk for severe illness. Notably, the guidance, again, applicable to Bexley does not include indoor masking absent, quote, high risk for severe illness. I read this as consistent with a board policy that makes masking optional. And tonight, almost exactly 2 years since the beginning of the pandemic, the board is again asked to balance the health, welfare, and safety of staff, students, and close family members against the cost of compliance using all available data. My support for policy explicitly rooted in deference to epidemiological experts should not be mistaken for a dislike of masks or a cavalier attitude toward a very real and deadly disease. It is also not the product of political or personal opinion, which I strongly believe have little or no place in civil discourse concerning public health decisions. A mask optional policy may also differentiate those who are at risk for high risk for severe illness. And as Dr. Williams pointed out in his presentation, that's a real legitimate concern shared by family and friends of mine. I think all of us probably. Some of us simply feel more comfortable masking indoors. As a result, I urge the board and Dr. Fine to carefully consider the exact message and language of any such changes to the status quo to ensure that the kindness and genuine concern for one another's well-being here in Bexley sit at the forefront of any such policy. Most importantly, the policy should make it clear that it is based on professional guidance and that should data change, for example, should Franklin County return to a different state than we're in right now, that we may need to move back into mandatory indoor masking. Thank you for your time this evening.
Thank you so much. On behalf of the board, I appreciate you coming and sharing those thoughts.
Sandra Grisham.
I didn't prepare anything, so I'm going to go off the cuff here. My name is Sandra Grisham. I live at 223 North Remington Road. I've been a resident of Bexley for almost 19 years. We moved here right after I had my daughter, and we were happy here for a long time. I have 2 kids. I have one other child in the school district. He's a sophomore, and we've been really happy with the district up until March of 2020. I honestly don't know what happened into this community. I can only share my experience, but we experienced public shaming for letting our daughter and my son be outside with their friends. The school district has not been a leader. It encouraged, it closed the playgrounds. It just, and listening to Dr. Harley's presentation, if I had elementary kids in the school district right now, there would be a for sale sign in my yard. I would go and live with my dad. That is how I feel. That is what saddens me of how this district has become. I don't know. I'm grateful for the education that my daughter got. She is knocking it out of the park in college. And my son is, by the grace of God, he is doing well. Not because of how this district has handled the pandemic. My husband is from a small town in Ohio, Minster, Ohio. We are in contact with our relatives there all the time. I want you all to just use common sense. We have data now for 2 years worth of data for districts all around the state that have been in school much more than Bexley has. I mean, it's almost embarrassing when I tell them what's been happening in this school district. I just don't know what else I can say. I mean, you all are smart, educated people too. I have a master's in public administration. I've worked in public health for most of my adult life. I just think at some point, we just have to be honest with what's important here. And I don't think we've done a service to our children, to the youth in this community, and the way we have treated each other as well. And like I said, I'm grateful for everything we've had, the experience for our kids, but it has changed, and it really saddens me. And I just hope that we've talked about metrics for on-ramp, off-ramp, and it really comes down to personal responsibility and individual choice. And we have the information that we have a very high rate of vaccination rates here, much more than in Minster, Ohio. Oh my goodness, it's only 5 or 10% there. And they've been in person all year, last year too. And I just also want to say that those of us that are advocating for having individual choice, like mass option, we have people in our family that are at risk of, like, I lost a nephew in March of 2020. My mother-in-law died of a respiratory failure. None of it was COVID related. Illness continues, illness happens. That's just part of life, all right? I mean, I know I'm not saying anything new here, but I wanted a chance to just speak my truth to all of you, because I've been silent far too long. So with that, I'll close. Thank you very much.
Thank you. I appreciate your coming in on behalf of the board.
Jennifer Durkin.
Hi, my name is Jennifer Durkin. I live at 824 South Remington. I've lived in Bexley for 8 years. We're business owners. We love this community. And I am the mom of 3 young children. My oldest is a first grader at Montrose. And I want to speak today to the experience of our young children, specifically the experience of our kindergartners, first graders, and second graders, because I've heard it said that they don't know any different. But I'm here to tell you, as parents, as leaders and educators, we do. And we have an opportunity to really serve these children and the experience that they are getting. So here's my experience. Last year, we homeschooled for kindergarten. COVID happened. We had the resources and ability to do that. It was hard. I have a huge respect for educators and what you do. But I also learned a lot about how young children develop and create a love of learning. We started here in first grade. I was excited, but over the last few months, I have to admit that I have been saddened to hear my 6-year-old come home and say things like, "School's always the same thing, Mom. I wish I could talk to my friends at lunch." When his one table partner was absent, he sat by himself. And it's super sad. I asked him what could make lunch better. I drew him notes and pictures to keep him entertained. He's asked me if COVID's the worst thing in the world that could happen to him. I've said no. He's told me that he's gotten rewards when he can just sit quietly and keep his hands to himself and not have to say anything or talk to his friends. This is not the experience I think we want for our young children. So here's my call to action for each one of you and for myself. And this begins now. And as we change mitigation strategies, we need to consider the entire experience. We need to create opportunities to learn inside and outside the classroom. Our children have not been on field trips, have not walked to the library, have not had guests in their classrooms. As a room parent, I have not had the privilege of going in to read a book, to do an experiment, to talk to them and serve our teachers who are working so hard. We all desire our children to embody the mission of our community and schools, to be bold, to be champions, and to find a sense of empowered belonging. We must lead by example and create these opportunities. This can and should include field trips, community resources, the library, the zoo, the conservatory, authors, artists, engaged and informed community members, and parents. This needs to happen in our classrooms. It is all designed to provide a love of learning for our children. And I know that the future of our children here in Bexley require these experiences so that they can think of school as engaging, exciting, optimistic, fun. So as we move away from these mitigation strategies, which I do believe it is time to do, I would ask that we also have a plan about how to specifically address the needs of our kindergartners, first graders, second graders, and our young children who do not have extracurricular opportunities within the school, to develop friendships, social awareness, and exposure to new ideas, to diverse thinking, to creativity and stimulation that makes them excited to be learners in our communities. I ask that in addition to a plan to address this, we start to bridge the chasm that has been created between home and school and parents and teachers. I never thought I would never see the inside of my child's school or the inside of their classroom. It breaks my heart. And I want my students and my children to see me standing side by side with their teachers, serving them, engaged, and creating opportunities. So I ask that we have a clear plan, that we communicate and involve parents in this process. And I also ask that we would find ways to unburden our teachers, to allow them to use old ways and new ways of cultivating lifelong learners in our community. Thank you.
Thank you. I appreciate your thoughts very much on behalf of the board. We're just going to take 1 second while Alicia. Just give her 1 minute. Thank you, Kyle.
Next is Diana Contasta.
I'm Diana Contasta. I reside at 834 South Remington Road. We've lived in South Bexley now for 10 years, and we have 3 young children. Our oldest Everett is in 1st grade at Montrose. I first want to just thank you all. You've done an amazing job these last 2 years, keeping our children, our community safe. And I know I can't even imagine the difficulty of trying to navigate all of that. So thank you. Last year we did homeschool as well due to the pandemic. So this is our first year putting our oldest in the Bexley school system. Our 1st grader does have Molly McCarrick, and we absolutely adore her and think the world of her. So I just want to throw that in there. Today I want to speak to you guys, not in regards to masking, but instead about bringing back the creative learning opportunities. And these are things that can happen in the classroom. These are things that can happen outside of the classroom. But having homeschooled last year, I realized how much learning these young kids can do in that non-traditional manner and how much they thrive in that environment. With this being our first experience, we've only been able to hear about all the amazing opportunities and experiences that existed pre-pandemic. Our younger kids may not know what they're missing, but we sure do as parents. They haven't taken a field trip. They haven't gone to the apple orchard, which I guess they do. I guess they used to go to the zoo, walk to the library, have a special person day. But I'm a room parent and I haven't been in the classroom. After 2 years, we know there are safe ways to do these activities. We know better. Our kids deserve better. That's our job. And I feel like we are really failing our children in that aspect. The children, they're our future. And I don't know how we expect them to be able to pour and give back to our community and to each other if we're not doing that for them. So thank you for your time.
Thank you so much. I appreciate it. Thank you.
Alana Spector.
This is my big preparation. I'm Ilana Spector. I live at 2444 Fair Avenue, and I'm here today not to tell you whether you should support or not support a masking mandate. I'm not an expert. I have that self-awareness. I don't believe anyone else who's spoken is an expert, and I feel that the expert data is what it is. I'm here to give another perspective. I hear the other parents talk about empathy and about play dates and sleepovers. Well, not all the kids in our town are able to do that with COVID. I personally have a child who is a severe asthmatic. He spent basically the year between 2 and 3 years old in the hospital. And I have a senior who is also medically fragile. She spent most of last year, actually more than an entire year, in and out of the hospital, doctor's offices, feeding tube, which most people know because she was able to go back to school this year with it. She doesn't have the ability to show up to this building and not mask. And I think that there's a lot more students there that have that type of issue. And I can tell you, my 13-year-old son has already told me that he's not going to wear a mask, not because he doesn't want to, but because he is afraid of the comments that the other students will make. And I don't see an empathy. I don't see it. I don't see it in some of the things I heard tonight. I don't see it around the buildings. But really what I want to talk about is someone touched on having a plan. If you vote to suspend masks mandated, I want to ask the questions that I have heard from speaking with people in other districts. I have heard repeatedly about teachers who, for their own personal reasons like pregnancy, young children under 5, underlying conditions, elderly parents who have decided to utilize FMLA. That has created in these districts, and I've talked to many, including some of the ones that have been mentioned here, about a number of teachers who have opted to use their FMLA, creating more absences. We already have an issue with unfilled positions. I believe you said there was an average at 50 something, and we celebrated a day of 40 with 7 unfilled positions. So what's the plan? Further, the other repeated thing I heard was that there are other illnesses now spreading more rampantly because we're unmasking. Colds, strep, flu, and the always pleasant norovirus. I know of several in our community who have picked that up in the last week. So I ask again, what is the plan as both students and teachers are out of school because of these illnesses, which are clearly going to spread more rapidly because we haven't had any exposure to them in 2.5 years. I saw the plan where it said teachers are not going to be the ones who are going to monitor who has to be wearing a mask to stay. So who's going to be doing that? Saying that you're going to require students who come back after 5 days of isolation is great, but who's going to know? Who's going to make sure they're wearing the masks? I heard you say that students who come back will be encouraged to sit 6 feet apart. Again, encouraged. Who's monitoring these things? So I'm just saying that one of the things this district has been very poor in is actually looking at the downstream consequences of actions. If we do decide to go mask optional, I think these things should be in place, and it shouldn't be something we do without knowing how these things are going to happen first. My other point is that the date, I believe, is March 4th, which is this Friday. That leaves 4.5 days until spring break. I don't understand the timing. By the way, I hear you all whispering. I think that's really rude. We're talking about empathy, and yet the people
I
in the room
appreciate
can't
the
even.
whole room keeping quiet while we have speaking. I
Yeah,
appreciate
just
that.
rude. So my point is we have spring break in 4.5 days after this is supposed to be lifted. Many of us plan to visit friends, family, college campuses. I'm not sure that why the timing of it needs to be before the break. It would make sense to try to mitigate the exposure to viruses until at least after many people have travel plans. I'm just asking and questioning why the March 4th date. That's all I need to say. Thank you.
Thank you so much on behalf of the board. I really appreciate you coming in and sharing those thoughts.
Celia Parrish.
Testifying tonight. She's got a little stage fright. I think I'm next after her.
Look down.
Okay.
Does she want to try another?
I beg your pardon? Yeah, we'll see. I could go. We'll see if she wants to go.
Mark.
Okay.
Thank you all. Mark Parrish. I'm a father of Celia Parrish, a second grader at Montrose Elementary, and I live at 640 Eau Claire. I'm here advocating for a switch to mask optional for all of our children. Simply put, this needs to become an individual choice as opposed to a mandated policy. One cannot morally justify collective burdens when individual action can neutralize the risk for whomever wishes to have that risk neutralized. Those that feel they need additional protection can take charge of their own situation and continue to wear a mask, or even better, get a vaccine with actual known benefits. To date, we have implemented a policy which trades off known harms, social emotional development, communication limitations, increased anxiety and depression, and a bunch of others people are speaking so eloquently to. And we've done that for completely unknown benefits. That's crazy, absolutely crazy. The kids have been wearing mostly cloth masks for over a year. The list of experts who now admit cloth masks do nothing grows daily. Now they're nothing more than facial decorations. We should celebrate this fact. The fact that it didn't matter in our schools and they stayed safe is because the kids are at such low risk. We live in an information-glutted world where one can essentially find evidence for any theory one desires and where different people inhabit separate real world and online realities. We've all seen it. Data becomes kind of problematic. So I'm not going to bore you with reams of data. But contrary to what we tell ourselves, to a large degree, we did not arrive here at this moment through clear-headed analysis of incontrovertible data. We arrived in this place mostly through emotion and especially fear. And we're going to leave this moment in this situation when that fear abates. Reason has been on hiatus. If reason and true science were in charge, we would have focused on falsifiability. Why falsifiability? What is falsifiable can be measured. It can be observed. That is science. And so that said, I don't do emotion well, and I'm going to give reason one more try here in this forum. Like many of you, I've spent thousands of hours at this point researching various pandemic topics and poring over medical studies. I know what you're thinking. One more parent who did his own research. Well, doing one's own research is at the heart of knowledge attainment and education itself. And studying primary sources matters. Sometimes you do have to take it into your own hands. I'm going to keep this light and provide you only 2 data points. This data has been measured and it can be falsified. Ohio school masking. Using the Ohio COVID dashboard for schools, you can download their publicly available CVS files. And with a few parents throughout the state, we tracked cases for all Ohio school districts from August 16th to October 28th, first 10 weeks of school. Finally gave up on this effort because it took so much effort, but the results were illuminating. The total percentage of students across the entire state of Ohio who contracted COVID over the first 10 weeks of school in mask optional schools, 3.76%. The total number of students who contracted COVID over those 10 weeks in mask mandated schools, 3.76%. Amazing. This covered over 1 million school kids in Ohio, and those groups were relatively equal sized during the time of that study period. When this got too hard to continue tracking, luckily Michigan stepped into the void. Michigan did their own school masking study. University of Michigan did a similar study that I was doing in Ohio, where they published their data through early November to favorable press because it was showing mandates work. Never mind the obvious divergence of school districts before the study window. Well, Michigan stopped publishing that study update in early December. Why? Because the data radically flipped and the narrative was lost. Whoops. They're now in the exact same position as Ohio. No statistically significant difference between mandate and optional school districts, none whatsoever. We've all seen this. There's no observable data where mandates are instituted that suggest they work, not in adjacent school districts, cities, counties, or states. Quite simply, this should be the end of it. We should be immediately turning our attention to ensuring this never happens again. We are literally one of the last places in the country to be having this conversation. You can call that prudence. I believe it shows a tremendous lack of courage and leadership. Data showing the lack of mask efficacy has been around for well over a year. I shared some of that in this forum in August. Now, there's going to be pressure in the future to pull this lever, and we should be putting protocols back in place. We should be putting protocols in place now to ensure that we resist that pressure and fear, and we never do this again. Thank you.
Thank you for coming in. I appreciate it. Kyle, how many more people do we have? I think we're past the half hour.
We have 4 or 5, including Celia.
Okay, so does somebody on the board want to make a motion to extend the time to cover, for 25 minutes, that would cover that?
A second.
Thank you, thank you. All in favor of extending the public comment period, please signify by saying aye.
Aye.
Aye. Any opposed? Great, thank you.
Thank you. Are we ready for next? Staldero.
Solidaro, 124 South Remington. Last month, parents in the district received a letter from middle school administration regarding issues with behavior and rule following at school. It was a new situation to most of us, as this has not been a systemic problem in the past. It is worth asking ourselves if one of the possible reasons for this upswing in student intransigence is the behavior of the adults in our community. Society needs rules, schools need rules, but when the rules are manifestly arbitrary, absurd, or unfair, while simultaneously regarded as logical and scientific by those implementing them, the result is deserved contempt from parents and students alike. For example, the ridiculous and unsigned health pledge remains on the school website despite its ludicrous recommendations. Students have been instructed over recent months that it's okay to play basketball or even wrestle an opponent, but not okay to shake hands afterwards because of science, I suppose. And of course, there is the pinnacle of COVID absurdity, the band mask. For those unaware, that's a mask with a giant hole in the middle of it to allow students to play their instruments. If that seems odd, don't worry, because we were also treated to the image of our kids playing their brass instruments with drawstring sneaker bags over the bells of their trombones and trumpets. That actually happened. We snicker because of the idiocy. But when you demand compliance with rules such as these, you do not make anyone safer, you breed cynicism and deserve mockery. While these rules are ridiculous and silly, many are far more harmful. Separating children at ski club by patronizing an establishment that demands unvaccinated children only venture into certain areas and marks those who are clean with a sticker to show it. Demanding that young children go to school for years at a time without seeing their teachers' faces or those of their classmates while expecting them to learn to read, speak, and pronounce. And finally, the near universal denial of mask exemptions by what appears to be a single, wholly unqualified individual who requests documentation but cannot enunciate exactly what kind of documentation is required. An individual who rejects the opinions of parents and qualified medical experts as to the appropriate course of action for their children. This happens repeatedly with frankly asinine reasoning, but the full weight of authority that cannot be questioned or appealed. And I quote Dr. Williams, "This decision is final and will not be revisited." It is truly grotesque. These rules breed contempt because they are contemptible. So where does that leave us tonight? Masks are possibly going away because the CDC decided that what was absolutely necessary 4 days ago is suddenly not, because of science or because of the presidential party's dismal electoral prospects. As we kiss these unethical and ridiculous rules goodbye, it should be for good. Do not attempt to take credit for the perfectly natural course of a seasonal respiratory virus that has spread similarly throughout the state and country, regardless of the hubris of elected and appointed officials' attempt to mitigate it. Dr. Fine certainly demonstrated a manifest lack of curiosity as to exactly how it was possible that hundreds of schools in Ohio, some 10 minutes from here, to say nothing of thousands of more nationally, managed to stay open for 2 years, not one, but two, without required masks or even contact tracing. I bet most of them even kept their concession stands open. He may not wonder how they pulled it off, but there are 5 board members here with a variety of degrees and accomplishments. Maybe one of you could investigate this mystery over the summer so as to avoid a similar issue next year. Going forward into the summer and fall, understand that all policies must be grounded in 2 fundamental concepts: bodily autonomy and informed consent. These principles are the cornerstone of the ethical practice of medicine and public health and should not be disregarded. If any parents in this community desires the advice of Dr. Fine, Dr. Williams, or anyone else as to the appropriate course of action when their child is sick, when and what diagnostic testing is appropriate, or what medical devices or drugs they should utilize, they are absolutely welcome to ask you. You have an advisory board, feel free to give advice, just as Dr. Kaplansky and Dr. Kadamian and myself do countless times a day. Despite our qualifications, our advice is not always followed, as the patient reserves their own autonomy. It is far past time that our children are given the same consideration. This board and administration's unsolicited advice is no longer welcome.
Thank you, Dr. Darrow. I appreciate your comments.
Monique Kadamian. I'm going to say that wrong again. Sorry.
I'm Monique Kadamian. I live 2524 Bexley Park Road. I'll be pretty brief, but as we move into the future, I stand here to remind you that our parents and children will not quickly forget the cumulative effects of the prolonged and unnecessary quarantines, mask mandates, isolation, and distance learning put on our children. We will not forget the families that pulled their children from Bexley City Schools to find a community that was more quickly accepting of the importance of informed consent, bodily autonomy, and parental and family decisions. We will not forget the families who have moved away from our community. Moving forward, children belong in schools and deserve an environment that fosters their overall physical and mental health, emotional, social, and spiritual well-being. Masks should remain optional and medical decisions should be left to individuals and guardians based on informed consent. There is no on-ramp, Bexley. Discrimination based on masking choice, vaccination status, and other private medical decisions will not be tolerated. Respect for individual decisions and views will be respected by all of our parents, as we all want what is best for our children, and that unites us all. Actions and decisions that threaten any of these fundamental concepts will be met with increased resistance and even more families who pull their children out of our schools and move out of our community altogether. Thank you.
Thank you for coming in and sharing your thoughts. I appreciate it.
David Kaplansky.
David Kaplansky, 2524 Bexley Park as well. And I wasn't so sure that I was going to come in and say anything today, even though I prepared. I was hoping I wouldn't really feel the need, but after that presentation, this is what I have to say. It is time that City Council and School Board realize that their efforts to control our behaviors in Bexley did not save any lives. If they did, where is the proof? They should admit that the mitigation policies they supported probably did more harm than good. It was the board's responsibility to engage in meaningful consultation with the stakeholders, and that includes students and families, as well as school and district administrators, teachers, principals, school leaders, and give the public an opportunity to provide input in the development of its plan. Instead of patting themselves on the back for a job well done, they should admit their regret for ignoring those of us who have reached out with warnings that masking should be an individual choice based on science. Even after the majority of the country had immediately dropped masking based on decreasing concern of threat and data supporting that cloth masking is nothing more than virtue signaling, our superintendent felt sticking to his decision of universal masking without an off-ramp plan was justified. It's just not time, he said, washing away the idea of immediate action. Claims that teacher absent remained a major concern, or that he has chosen to take the path of being cautious despite so many other schools forging through the last year without universal masking. Simply, COVID was not putting our teachers or children in the hospital, or was it affecting the spread at all? Is that because of masking? I dare to say you must prove it. Why was Bexley the last suburban school district in Columbus to want to allow parents to make the choice? The school board should personally apologize. And I say that to Dr. Williams. I personally apologize to all families who were denied exemptions for universal masking. We were powerless to help our children lest we leave the district and follow some of those families that already have. I appreciate the gesture of lowering the universal masking requirement. I hesitate saying that because I don't feel like you have. I feel like you've put it on pause and you're setting us up. But we are coming with a warning. We will not comply. We will not comply with any similar mandates if they are brought forth in the future. We have been watching closely as there are innuendos of setting policies that allow cities and schools to reach back to masking and quarantining healthy children based on metrics that have not served us well. We will require much more than the CDC says it's a good idea. Our goal should always be to provide the most normal experience for our children as possible. I'm very impressed with what they have said about the experiences that our children have missed. I have not seen the inside of the school in 2 years. That's crazy to me. Some of these children will be afraid to remove a mask for weeks, months, maybe years or forever. They might be permanently scarred. They will be anxious that a child with a sniffle may kill them or their grandmother. That is what we have brainwashed them to believe. Why else would their teachers be snapping at them to cover their nose when their mask slips? So many people fell in line when they were asked to wear a mask. It seemed like the right thing to do if we could just slow down the spread of the virus that was causing so many to be sick. We made many decisions, such as closing the schools for several months, which I hope we can say we could have done differently and are regretful. We come as a large group today to make sure that you hear us loud and clear. When it comes to masking, it should be the advice of parents and not the school board or administrators. This specific board has chosen to be cautious against a germ despite their actions affecting our children's learning experience and likely leading to mental health issues in large numbers. Thank you for the opportunity to speak at this public forum.
Thank you, Dr. Kaplansky. I appreciate your comments on behalf of the board.
Stacy Gaines.
Hi, I'm Stacy Gaines. I live at 2629 Bexley Park. This is my first time actually in City Hall. I've lived here for 24 years. I'm just going to pick up on a couple of things. There was someone who said earlier that the district had done a poor job of looking at the downstream consequences. And I agree with that in a completely different way than it was meant. Dr. Fine mentioned mental health in his opening comments, and it's there that I'm going to pick up. There seems to have been an assumption that protecting our kids from a virus that doesn't impact them significantly is above all else the priority. Hence the masking and all the smoke and mirrors that went along with it. Never in history have we allowed our children to be compromised for the theoretical benefit of adults. How can it be that the entire country of Sweden, population 8 million, had no masks, no remote schooling, and had 0 COVID deaths of any child under the age of 16? But our kids have been compromised. Don't think for a second that we were successful in protecting our kids. They were protected by millions of years of evolution, not porous masks worn part of the day. As a mom who watched her child, grad of 2020, miss out on all the senior year joys that were rightfully his, and as a mom who watched an amazing group of young people mentally deteriorate in the last 2 years, children who were great young people who were graduating 2020, I have watched this group of kids go through something that I never imagined I would watch these kids go through. They have been impacted. They have been impacted seriously. And part of what has happened here has made that impact on our children. I work at a preschool. I watch the kids. I see what's happening to their young lives, and they are impacted significantly. I will tell you that all the money that's gone into masks and all of the things that you've put in place for safety, you need to be putting into speech therapy, because I can tell you that 80% of the kids coming in next year have speech issues. They cannot pronounce anything appropriately as a 5-year-old should. The kids have anxiety, tremendous anxiety. Young children who are 5 years old are coming into your school with anxiety. They are afraid to be hugged by their teachers for fear of the virus. They are afraid that if they have a cold, they're going to be kicked out of school because they have sniffles, or if they have an allergy, they're going to be kicked out of school and won't be allowed to play with their friends. These kids have been impacted. So don't think for a second that what you think you did by protecting them from COVID protected them. There have been serious, serious consequences, and none of them are related to their physical health.
Thank you. I appreciate your comments on behalf of the board.
We just have Celia if she'd like to come up. But no pressure, right?
Thank you.
That's all, Ms. Powers.
I do want to say thank you to the community, took the time to come in and speak. I know it's not always an easy thing to do, and we've had a lot of input from our community, and it's good to have people who are willing to come in and give us advice, input, thoughts. So I appreciate it very much. We're going to next turn to our discussion. And I want to start by turning to our student representative, Quinn Hall. I know that Quinn has taken it upon himself at the superintendent's request, and I think his own initiative, to talk to students. And I know he shared some of that with Dr. Fine, and I'd like him to share it with us. So thank you, Quinn.
Thank you, Dr. Fine, and thank you, board members. I appreciate having the ability to speak on this issue. As I'm the student representative on the board, it is my job to be a voice for students. Over the past week, I've had numerous conversations with my friends and classmates about this issue. The overwhelming consensus from these conversations is that masks should be made optional at this time. That being said, I'm a senior and only interact with a small percentage of the student body on a daily basis. In recognition of this, I have also had more formal conversations with each of the 4 class presidents, the 4 members of the executive board, all of whom are seniors, and the 3 committee chairs from the communications, policy, and events committees, all of whom are juniors. It is these people's jobs to be leaders in the school, and in the case of the class presidents, leaders in their class. They are tasked with discussing issues with their classmates and gaining a general perspective of the will of the entire school. Through these conversations, I have been able to gain a more holistic view of the opinions of the high school student population. In all of these conversations, we reached the same conclusion. The vast majority of students in the high school believe that masks should be made optional at this point in time. The documents I've passed around are emails from the class presidents, executive board members, and committee chairs echoing my sentiments. I acknowledge that this perspective is not universal and that there are some students who disagree. That being said, I can confidently say, based on the feedback I've received, that the vast majority of students in high school support lifting the mask mandate. Dr. Williams already addressed this, but I think there are numerous things playing into this perspective among the student population. Case numbers and hospitalizations are declining in Ohio and Franklin County. A very large percentage of our community is vaccinated, and the mask mandate was recently lifted in both Bexley and Columbus. Based on all of these things, I believe that now is an appropriate time to lift the mask mandate. The last thing I want to say is that I have great faith in all of my classmates to be respectful towards their fellow classmates, whether or not they decide to wear a mask. Thank you.
That's so helpful. Thank you, Quinn. That's really very encouraging and helpful to hear not only the students' input, but also their commitment to kindness and continuing to engage respectfully and with civility and grace. So thank you so much. It's now time for the board members to ask questions of Dr. Fine, Dr. Williams. I want to start, Jonathan, with you because I know you have some specific things that you want to bring up.
Yes, thank you very much, Victoria. And thank you very much, Brad, for helping out. This is the 10-year anniversary of Trayvon Martin's death, for those who are not aware. So I was about the same age when I was told that I fit a certain description, and no one asked for my university ID to confirm that I was in fact a student at a university. Okay. There we go. Thank you. So that's why I wore this shirt today, because I could not be here possibly. So anyway, I've been looking at the data that's been talked about a little bit here throughout this evening. And yes, in fact, the COVID numbers are down as far as cases. And Brad, make it bigger. The other way.
Go back to slide two.
Slideshow, yeah. And then like
There you go.
as big as it gets. You can't change the Zoom feature.
That's good. That's good. I can read it.
Oh, okay. Well, we can send these out if we need to. But the point is this. If we look at, you can see if you squint, or go back a slide. Okay, so we have 79,900 cases, I guess, currently. That is down 79% from a month ago, and it's down 37% from a week ago. And in Ohio, similarly, it's down 82% from a month ago, and 39%, 40% from a week ago. I don't have the hospitalization data or the ICU data, but you see from a week ago, it's down 30% for both of those. If you compare today's data to last week. Next slide. I got that one. Okay. And then, so I decided we get this data set from Jason and Dr. Fine, the CATS data, right? Which includes data about 16 districts plus Bexley. And so I intentionally chose New Albany and Upper Arlington to look at those schools, because I know people are there that I can kind of ask questions to. I had my computer, Microsoft Excel, randomly choose two of the other schools. In this case, they chose Dublin and Hamilton school districts. It turns out that New Albany has been mask optional for the whole school year, yes. And it turns out that Hamilton similarly. And if you look at the data, their current rate is 90% lower than it was a month ago for New Albany, and 41% lower than a week ago. And then similarly for Hamilton, it's 90% lower and 52% lower. So the districts that have had this mask optional piece did not experience a stagnation or an increase in the last week or two. And so I compared that to Bexley, and Bexley, so it's like the same kind of trend, mask or no mask, for these different districts. And I chose to look at those in particular. And so just as quickly as it seemed that cases and so forth skyrocketed to end 2021, they're now indeed plummeting across Central Ohio. And so it seems like COVID is taking somewhat of an off-ramp, if you will, from Central Ohio, and of course, larger than that. But I guess the key thing I want to talk about now is, as we look at low vaccination rates, or kind of plateauing at 60% or so, and one of our key goals has been always to consistently perform our core function of teaching students, right? Keeping students in school, as Dr. Fine would say. And so I guess now what I want people to think about is, a time for a new on-ramp, an on-ramp towards empathy, an on-ramp towards, this idea of mask optional. I think I've seen it before from about a year ago, quite honestly, where the idea was like, if you were vaccinated, the mask was option, at certain settings. And so I go to places where at the time, 40% of Ohioans were vaccinated, but then I go certain places and like 80% of people, 90% of people weren't wearing masks. So it seemed like mask optional became mask non-existent. And so even one time I remember wearing a mask and someone's like, what's wrong with you, Jonathan, wearing the mask? And so optional, in my opinion, implies neutrality, and it should be without judgment, opting in or opting out. And so for those who opt in, if down the road we go a certain direction, it's going to take an immense amount of emotional fortitude and courage to do so, to go against the potential wave of droves of people who are going different, contrary to yourself. And so I think we have to be careful that mask optional does not become mask shaming and does not become mask discouraged. And I think we as adults can set the tune or set the tone for how that is carried out in our schools and other places. I think it will take a step further on, not just saying, hey, my friend wants to wear a mask or not wear a mask, and that's okay, but my friend has a different view than I do. What can I do to preserve that friendship? Do I need to go to their house? Do I need to act differently? I know we're not going to talk down on people who have different views than we do. I know that for a fact, but we might need to go a step further. We might need to be an advocate. And so Bexley, we've been kind a year ago in the same kind of season in spring, and being kind to in an era where there's Asian hate that was picking up about a year ago. There's been bullying opportunities based on race, gender, ethnicity. And I think this could be, to some extent, an opportunity to be kind in a new area, a kindness that we have not quite seen before. Personally, I teach at Ohio State, and I remember how uncomfortable I felt teaching my students the first time I went back in person to a class of 150. I couldn't see their faces. My voice is muffled. It's muffled even now. I often had to adjust my due dates and my assignments for my students. I had some students are quarantined, some students are isolating. I had to keep track of who was doing what. And I'm sure my BCS or our BCSD staff did even more than this. And we forget that they signed up to be teachers. They want to see their students' faces. This is part of who they are. And so, but I think that there's a part where we've also in this era have heard that there's a segment of our student population that disregarded and disrespected some of our staff. And that can't be. And adults, again, we play a significant role in setting the tone here. And so I think we need to remember that teachers and staff are Bexley's version of first responders, or some of our first responders. And they need to be respected accordingly. And so they've made some changes to their classrooms in huge ways because they want to preserve our core function of educating students. Marguerite and I both have daughters who graduated in class 2020. Senior prom is gone for them, period. I have a middle school daughter. Her entire middle school career is impacted by COVID. 6th grade was a shutdown. 7th grade was all the different hybrids. 8th grade is the current year. My kids, they talk about middle school, and my youngest kid doesn't quite understand the same thing. And so I hear you. You talk about the affective side and the social emotional side of this pandemic. The style, the climate has changed, but yet the core function of teaching and learning has persisted. So she will matriculate into high school next year, and we're grateful for that. But Bexley, I implore you to embrace this new on-ramp, an on-ramp of empathy towards staff and students, and possibly a new visible minority As always, it will take the dominant group to use its power to provide a safe space for those who are at the margins. In this case, for those who continue to opt in to wear a mask, even if their perspective tarries deep into 2022. That's all I gotta say.
Thank you. I appreciate it. Other questions? Anybody have questions?
Go ahead. Dr. Williams, I did have a few questions for you. I'm sorry. So the CDC language, and I should have wrote what slide that was. I'm sorry, but the CDC guidelines are not binding, I think is what you said. It's guidance, correct?
Correct.
And they said it should not, I apologize, I'm getting over a sinus infection. So I apologize that I have to keep stopping. But the CDC says that they should not stop wearing masks if you are COVID positive. What's the?
Yeah, the agency says that people with COVID-19 symptoms and who test positive should not stop wearing masks, or in other words, they should still continue to wear a mask.
I guess I'm confused on how we can discipline or remove a mask mandate if it's been lifted in the county and in our state, in our local area, and it still ensure social emotional well-being, but discipline students potentially if they choose not to wear a mask. I guess it sounded a little double talk to me. So can you kind of walk me through? I think it might have been you, Dr. Fine, that said potentially students could be removed or disciplined if they opted not to wear a mask.
Okay, I think I know where you're going.
Thank you.
Yeah, we still have an obligation as a school district through public health orders to people with communicable diseases need to be removed from the population of the school. And so that was a point that was being made there, that the guideline allows students to come back to school on the condition that they can properly wear a mask and do properly wear a mask. So when that happens, our nurses will explain that to families. And our hope is that conversation and the honor system works and people will do to protect themselves and protect others in class while they're following that guidance.
So I guess my concern is the honor system gets really slippery.
Yeah.
Inconsistencies occur. And then, so I'm gonna just play devil's advocate.
Go ahead.
Adults and visitors now can come into our buildings, correct? They can come into our buildings unmasked. And they could potentially have COVID-19 or recovering from COVID-19, be asymptomatic. We don't know because that's their private health information, right?
Correct.
So how are we as a school, help me understand is what I'm saying, is help me understand how we can expect teachers, staff, and administrators to be checking if a student is on day 6, day 7, day 10 of returning back to school after maybe a COVID case.
Yeah, I'm being honest, we can't. That's why we're going to have the conversation, appeal to parents, appeal to students. And then should something be noticed that we're not actually, purposefully, going out and following students or things like that. But if it comes to our attention, we would certainly address it. But no, I don't have the capacity for a spread. Maybe for 5 or 6 students, we could easily do that. But if you can go back to January in case another situation like that would happen again, I would be foolish to tell you that we can monitor that with our staff and everything else. So our plan is to communicate with families. And I have seen, working with the families for the last 3 months, I would say 95% of them have been supportive.
Right.
They want to do the right thing. They want to protect, they follow the guidance, and they've kept their kids home when they feel they've been close contact. I can't say it's happened 100% universally, but I would say I've been very pleased and I said, and I wanted to thank the community at the end because they have done, most people have done the right thing. And we're going to continue to encourage that and support those students that way. But if you're asking me, will teachers take attendance, I'm going to say no. We're not going to be able to do that.
So I
Yeah.
think,
Sorry.
that's okay.
So I would just reiterate that we have had lots of conversation in this arena. That's why the final conversation, the final vote, with the knowledge that that is going to be a real challenge. And it's been a real challenge in all of these other districts that we've listed and heard from this evening. I've talked with Mark Frank, the president of the Education Foundation. He's talked to dozens of teachers. That's a real concern for them. They don't have the capacity to monitor who should be on day 6, who should be on day 7. As Dr. Williams said, we are very thankful that we have a community that has responded appropriately. We are going to work really hard to ensure that they have the communication that is necessary so they know what is expected, what is required. Our goal is to work with our students and our families. Our principals are going to be talking with our staff members tomorrow morning. Our goal is to work as we have throughout this, at least this year, that I've been able to see. When we have concerns, having a conversation with our students, having a conversation with our families. But if we knowingly know that there is a child who has tested positive and is not wearing the mask, we will intervene and have conversations with students and family.
And can I just add a question on that? So it's my understanding that if you are aware that a student has tested positive, the district will send home a letter outlining the expectations, outlining the 5 days home, and then the 5 days in school masked. And so
Usually a phone call. as
usually
well.
a phone call,
A follow-up phone call.
a follow-up phone call. And if you know there's a student who is back from that, I appreciate that the teachers aren't going to be asked to be the, first responder on that issue. But I'm understanding that if the nurse is made aware, or if you become aware, you will do something
Support.
to try to intervene on that.
Correct.
I think I'm probably not articulating myself very well, and I apologize. My challenge with all of this is people are coming in and out of our schools every day. We don't have a 100% way of knowing who's transmitting or carrying or asymptomatic or not. And we are about to adopt a policy that binds staff in a way that says, hey, when your child comes back to school, you have to do X, Y, and Z for whatever period amount of time, in the same vein and in the same breath saying, hey, it's your option to do this because the CDC
No,
has.
it's not an option. It's a requirement based on,
It's a recommendation from the CDC. It's up to us to determine if it's a requirement.
to get to the mask to stay. That's
That's a requirement by Ohio law.
It's required by the Ohio Department of Health that the students who come in on day 6, they were able to come back in and enter isolation early if they come back and wear a mask for 10 days.
And let me
That's
just,
what we're following. And I know that I've heard the debate and I've lived the debate, but we have
Right.
followed public health guidance throughout as best as we could.
And I'm not trying to put you on the hot seat. I just see that going 0 to 60. And here's why I have a problem with it, Dr. Williams. I was sitting at a basketball game, packed, and everybody on our side is masked, following our rules. But across the way, not a single soul, maybe one, maybe two grandparents or of some sort might have had on a mask. And we regulated student activity, just being normal student kids, right? Doing whatever it is that they're doing. But we didn't go over and ask across the way for people in our buildings to follow a policy that we adopted, that we as a Board of Education adopted. We did not hold these visitors to this policy. So I'm asking, how can we even fathom to think we're going to hold children to this policy if it's their choice to not mask, right? If they choose not to do it, I'm just really struggling with that. I mean, and I've always struggled with it from 2020. I've struggled with it to today. I am really trying to wrap my head around, for the same reasons, sort of alluding to what Dr. Baker has said, when we start creating those divisions, at the very best attempts, children will be children. Things happen in classrooms, things happen on recess. I don't understand how a teacher or staff, if you can't even regulate what's visually in front of you. And there's no way, as a board member, I would have sent you over there to ask them because they were cuckoo for Cocoa Puffs in the first place, right? Like it would have gone haywire if you had went over and asked them, if an administrator had gone over to ask them to, hey, put on a mask, that's our policy. So I guess I'm just trying to wrap my head around, if we choose to make this a mask optional policy, knowing like we have data, we've been asking for that data, we've researched it on our own, we've seen it on our own, that there have been schools that have been in school, they've been mask optional, and their data looks like ours. It doesn't look different. That all these additional straps and steps and restrictions that we have just feels
Well, I think part of the reason why you mentioned the athletics, and that was really an insurmountable task and a lot of work for our administrators who had to work all day long, go to the evening events, try to tell parents to put mask on, they put their mask on, they lay them back down. I know myself, I was doing that not because we were obliged to enforce the rules as best as we could. But we were, to say we were overwhelmed, it would probably be an understatement. And then having the fatigue throughout that whole time, people did the best that they could. And I'm saying, when you make your decisions, we will do the best that we can to make sure that they're executed. That's our role as administrators.
I guess my fear is watching staff endure the abuse, let's just call it what it is, that comes when you're trying to enforce a policy that we're going to adopt. So I just encourage our board members to be thinking about that.
And
as we move forward.
I would add that I know my choice of words last month, talking about other districts. I meet every Tuesday for 9 months. Dr. Williams and I sit in a meeting with 40 plus local superintendents. I then get on the phone with many of them throughout the week. I asked the question last week of all of you who are mask optional, are you holding your community accountable for the mask to stay, test to play? And it was a unanimous yes.
How are they?
It's exactly what Dr. Williams said. Their staff cannot do it. They do not have the capacity. They expect that the adults and the parents have conversations with their children. It is on us as a community to follow these. If we see it, we will work with a family. We will not, our first step is not to remove, kick out, discipline. We want to work with families. We hope through our conversations, we've seen great success in Bexley. Joe Mazzola says it. He is thankful for the work that this community has done. Our community does great things when we explain the process to them, and that is our expectation. Our staff members cannot do it. They are doing everything they can to provide the world-class education, and for them to monitor because of the same thing or the reasons you're talking about, it will impact the learning environment, and that is not what we're asking them to do. They can assist, they can support. Let us as the administrative team help take that burden. But that's the feedback we are getting from Mark Frank and our staff. But knowing that is the decision in front of us. It's a great question.
So just to clarify, if there is a question about a student's masking after an isolation period, the nurse or the administrator, the principal will be the one to step in if it's needed. Is that correct?
Yeah, I guess the conversations we're having is that you would have a conversation, try to find out the why.
Yep.
What's going on? Why? What can we do? We got an agreement? We had an understanding. We communicate this is important. Is this possible still? And then That's always the first step when you're working with children, is try to understand their why and try to help them, and then explain. And then unfortunately, we might have to be in a position like we have to send students home with lice sometimes because they're still coming back to school with nits. We would do the same thing based on the public health guidance for communicable disease. If we find out that you're not able to wear your mask, then we would say, we would follow our guidance.
Okay.
No, right now.
I just need to go cough. I took my medicine, excuse me.
You can- I mean, my question's not for you, so if you want to stay there.
Oh, I didn't know she was
You can
finished.
hang- if you want to hang out, you can.
I'm
hang
here
out.
now. I'm
But
staying.
you stay right there and just enjoy it. You can stay, Harley, if you'd like to stay. I don't want you to feel, I just didn't want you to stand up there. I lost. All right. So I guess I have if the resolution passes and we want to be responsive and intentional to the comments that were here by all the parents, to all the emails we've been getting. I think Ted Cahill really sort of spoke to what are the systems and structures we're going to put in place to make this work, right? And so I'm curious about the specific plans to support young people and educators through this transition, because what is true, I mean, basically what Jennifer was talking about, like you've got 10th graders whose entire high school career has been, right? 7th graders who transition to middle school, which is incredibly difficult, right? In the best of days, middle school is a bit of a hot mess, right? You got 1st graders who've never been to school in the absence of a mask. So whether young people and educators are excited, right? Or whether they're ambivalent or whether they're anxious about this transition, this is still a big transition.
Yeah.
And it's going to be incredibly unsettling, however you land, like wherever you are. And so, I've seen some communications from central office instructing teachers to reestablish classroom norms, which is a what, but what I'm super interested in is the how. Right? And what supports and structures are in place to support educators through this transition. So when you've spoken to educators and we've spoken to students, what resources did they say they might be most helpful, right? And how might we invite educators to take Wednesday and Thursday to process together with students what a safe, welcoming, mask optional learning community might look like and feel like? What are their hopes and fears for Friday, for next week, for the remainder of this school year, right? Like we spend so much time trying to pretend like it's 2019 and we got to make up all the work that kids missed or whatever, whatever we think we need to do. Can we put a pause and say, we have been in 2 years of craziness and we're now going to try to transition, right? And wherever you are on masks, it's still a transition. So how do we invite teachers to say Wednesday and Thursday, let's get it, let's sit down, let's have a conversation. What are your hopes? What are your fears? What are you worried about? What do we need to do to make you feel safe, smart? How do we build a community in this new environment? I think this is a lot of what Jonathan was talking about in his on-ramp. And so what I'm really curious about is what systems and structures and resources do you have in place if this resolution passes tonight to use Wednesday and Thursday to prepare for Friday?
Yeah, I appreciate that. So I love what you said there at the end about it's not 2019 and it's stressful and it's chaotic. We've got amazing educators in the audience tonight. We give permission to our staff. They're going to hear it again tomorrow. I hope they've heard it already, to press pause and to have these really important conversations. So we've had some really important conversations as a leadership team. We've communicated with our principals. I believe all 5, tomorrow morning, have scheduled a staff meeting with every one of their staff. They have really important talking points that our entire leadership team has worked on to support our staff. First off, in the what. What is it that has changed tonight? What is the impact? What are the expectations? What can you do? What should you do? How do you find support? They're going to hear that from their building principals. They're also going to hear recommendations and suggestions for how to pull it off. And we're going to give them resources. They're actually going to get an email at the conclusion of tonight once we see where we land, encouraging them to reestablish classroom norms. They are the most incredible group of educators I've ever seen. This is their bread and butter. Their bread and butter is to establish relationships, reconnect with their students, establish norms as to how we will treat each other in this classroom, in the hallway, in the locker room, in the football stadium, whatever that is. They're going to reestablish those expectations. We've got some incredible resources. Marcellus Braxton provided us talking circles for staff members. We have some staff members that are really strong in that arena. We have other staff members that have not approached that. So we've given them resources, and we've also provided access to Marcellus if they want to look that way. Our district has been, we're expected. It is a requirement to participate in PBIS, positive behavioral intervention supports. Every building. I've been at a staff meeting and participated in what PBIS looks like for our district and what it looks like in each of our spaces. That's another opportunity for our students to dig into what it means to be living in the world beyond Thursday and Friday. But they have our permission to press pause and reconnect. We think content is super important, but it is not the priority this week. It is not the priority as we focus into that next moment as we reestablish the connections. I also want to say, I sign a lot of field trip forms. We are taking field trips. I give permission to everybody to take a field trip. It works for some, it doesn't work for others. I sign a lot. So that's new to me that we've stopped taking field trips because, in fact, I think you'll have an extended field trip on your form for the zoo at the next meeting. So we support that. We support those things. I think it's going to be important for us as a leadership team to also provide talking points for our principals about visitors and those sorts of things. We want that. I have two kids too. I want that experience for them. I appreciate you talking about your middle school experience. But we want what you want and what we heard tonight, and we got to do a better job of communicating. If folks didn't know we were taking field trips, then that's on me to communicate better. But I'm thankful for our counselors, our staff, our leadership team, our principals. They've got a great plan for the next 2 days. They're also going to communicate with their parents once that conversation has occurred with their staff, so that the parents know what's happening. We're going to send a communication to parents tonight as well that has some very brief talking points, because it's all overwhelming. But we feel that there are, just like our adorable student that was here tonight, she's got some thinking, she's got some thoughts. We want parents to be armed with some quick talking points so that they have a plan as they enter the building on Friday.
And I want to think about this, goes a little bit to what Jennifer was talking about, because I'm curious about how we might reimagine this spring, the whole spring. Like, we come back from spring break and we talk about strengthening relationships and really leaning into the joy of the work. I mean, the strain and the stress that educators and young people have experienced navigating this last few years has been incredible. And it's taken its toll on everybody. And unfortunately, so the myriad of additional complexities impacting mental health, social, emotional, and academic outcomes. And these manifest through some of the behavior things that we've talked about, some of the challenges that can burnout, disassociation, and these have only been exacerbated by trying to constantly make up. Like this idea that we've lost something, right? Like somehow that the scope and sequence and the pacing guide of 2019 are even relevant today, right? So what might be possible if we came back from spring break and put the pacing guides and the scope and sequences and the curriculum max aside and we focused on fostering curiosity, holding space simply for the joy of teaching and the joy. What might be the benefits of inviting educators to spend the spring working alongside the students to process the past 2 years through a wide range of mediums: art, music, creeds, podcasts, visual, whatever. And what might we gain if we offered educators the freedom to lean into their passion? Math, literature, art, history, whatever, and just start there. What if we made it possible if we invited them to spend the remaining months of this school year just loving teaching, so our students could love them? I mean, and not at no fault of teachers. It's just been and I think our teachers, what they have experienced, not we, the world, it's incredible, right? It's amazing. So how do we shift that and say, let go? and just love you. Make sure that when these kids these kids come back, they say, I made friends. I've seen every day somebody talk to me. I got to be my authentic self, right? I got to ask questions and they were answered. I got to learn things that were interesting to me. The teachers could say, I got to teach something that was interesting to me. I didn't spend the last 2 months trying to make up for the last 2 years, right? So I just think that, and this is in such a academically focused community. What might educators and community members need to let go of this spring? For our kids to leave 2020 saying this was the best team of my life. This was so awesome, right? And what might we need to hold on to? And I think however this lands, how do we position educators and kids to leave this school year, not thank God it's summer, but oh my God, we should not wait until the fall because we spent this summer doing amazing, incredible things.
Yeah.
I know relationships, I just want to think about, we've spent so much time sort of managing this crisis and the mental health crisis we're going to be managing for the next decade.
Mhm.
Is, I mean, people already know, like the research is already. So I'm wondering how do we send this message to our and to our community that there is a way that we can use this next 2 months to position our success, ourselves as a community, as students, as educators for success in the
Yeah. I really appreciate it. I thought it was beautifully said, and I don't imagine anyone in the space that disagrees. And I also, we want learning to be irresistible for our students. And we want the joy of teaching, which is why our amazing educators got into it. Unfortunately, there are things that get in the way that are mandates that come down from the state and local levels, and sometimes that come from me. And we have an amazing resource in Steve Shapiro. Steve Shapiro as a experiential learning opportunity. He just recently had a conversation around the achievement culture in Bexley and around. For every person who wants what you just said, there's another person that is really frustrated that there isn't more work provided, that there isn't more content driven, that there isn't more access to emails and responses. So I do think it is a staff and a community conversation that's really important. I want what you want. I think everybody in here wants exactly what you want. And it's for us as a team to figure out a process to make sure that our staff knows the joy of learning is what we expect. We give permission to press pause and do the things that you're talking about. And we talk about it all the time. And we also talk about what can we do to eliminate some of the noise, some of the mandates. How do we lessen it? How do we provide that in a different opportunity with the professional learning, whatever that is, to get creative with us as a team. But we want that. So it's a really important conversation that we're going to have to make sure that our staff understands it.
It's about communicating consistently with staff,
Yeah.
you can have both things. You can have academic-
Yeah, agreed. A balance. I love it. Thank you.
Other questions?
So I just have one question related to test to play. So you've asked for guidance on that. Have they said when they're going to come back? And are other districts also keeping test to play in place?
They are.
Okay.
We reached out to Franklin County Public Health, I think 48 hours ago. We've not heard back. Well, we did hear back. The question was, now that we're going to spring sports, we're outdoors, do we think that guidance would change? The response was, that's a great question. Let me dig into that. It's not atypical for us to not hear just yet. I think they're probably processing and discussing, but as soon as we hear, that's typically our test to play. Is we typically communicate that through our final forms and our athletes and our folks that are impacted, but we will communicate with everyone as soon as we learn.
Okay. And then when teachers are getting a chance to pause too, I assume that our nationwide counselors and our district counselors are also getting the opportunity to plan their work with students in the next coming weeks as things arise,
Right.
as we don't know what kind of issues will be in the classroom, out on the playground, in the community.
Yeah, our counselors actually did some amazing work already this week. They've created some resources for our each level. So our elementary, our middle and high counselors, that email, I believe, will be sent, or those resources will be sent to our staff soon after the communication of what has occurred at this conversation. And more talking points, avenues for conversations and support.
Great. And I'm sorry, I forgot to say this. Quinn, thank you for doing
Yeah.
this. These are really thoughtful comments that the students took time to write back to Quinn. They're very nice comments. So thank you for asking all them to do that. There's over a dozen here. So thank you for doing that. It's very helpful for us when we make our decision, that we hear from students too.
Dr. Fine, I just really quickly, is test to play a recommendation or is it a mandate?
It is we follow guidance by Franklin County Public Health. It's their guidance that we've continued to follow. There are things in there that they recommend. There are things in their policy that they require.
The reason I ask is even at the collegiate level, we test far more than some of the collegiate level athletes. We test more than what I know a lot of other Ohio schools and other areas. So how is Bexley required to do something that other school districts are not?
I think there's a way to minimally adopt what is being expected, and there's a way to follow it to the expectation of the information, which is what we've done. We've worked with Franklin County Public Health every time we've adjusted. They've supported the moves that we've made. And we were aware that we were probably doing more based on the guidance we were getting than other districts. We knew we were.
And is that an expectation that we're going to continue to do?
That's what we're working with Franklin County Public Health.
Because as a parent of an athlete, I thought it was excessive.
Yeah, yeah.
That's just my opinion, but
Yep. Thank you.
Have we cut back on some of the testing that we were doing under test to play?
Absolutely.
Yeah.
We learned, and it happened to me as a parent. I had and early on in the surge as a basketball player, she was asymptomatic, had to test and tested positive. And we experienced that routine. We've had the ability to have conversations with Nationwide Children's Hospital. Harley's done an incredible job. And we realized, not to mention we were going through too many tests at a critical time, that was not appropriate. So we have limited, I believe now we test on data exposure and then test out, as opposed to test every day of a contest. And if you're a basketball player, or at that time we had wrestling matches and cheerleading where things were happening so quickly, we were running out of kits. So we contacted Franklin County Public Health and they supported our moves.
So we were testing every time it was recommended, and now we're
Correct.
only testing when it's, they really say that
Day one.
and
Yeah,
it.
correct.
Okay, thank you. Does anybody else have any?
Sorry, I do also want to say Quinn Hall is amazing. Quinn Hall and I had the chance to meet in my office. He comes incredibly prepared. I think you do an incredible job of speaking on behalf of your peers. I know you've had conversation with staff members as well. It is not easy to do what you do. It is not easy to sit here and be asked some questions. You do it masterfully, and I'm really impressed. And I hope you'll consider going into education so we can hire you. But you are a superstar, and we thank you.
That's a fact. Thank you.
Well, a
Go ahead.
comment. So thank you very much for sharing, and thank you, Marguerite, for your comments. I really appreciate that. Really transcending the idea of what the mask is or not, I guess you could say, but we can do so much more. And I think that I really appreciate thinking totally outside of the mask, or outside the box. But we for so long kind of suppressed the social side, suppress, that let's go ahead and celebrate, or we'll see how it goes, but celebrate. And it can transcend how the school year goes. I mean, that's a mind blowing, of course. Like, even for my own classes, like, there are some chapters I have to get to, and then there's some that I want to get to. And I'm learning to put those that I want to get to aside and talk more about with my students about what it's been like, this kind of PTSD, so to speak.
Yeah.
And so that there's great value in that. And I think we, or you set the tone in terms of that, the freedom that teachers may have, that staff may have to do that. Of course, we know we have AP tests coming up and these kind of things that have certain criteria. But a freedom that can be very liberating. So that's all.
No, and I think it's one thing to come from Jason, but I think we as a community, as board members, like, the teachers are like, every parent comes up and says, what are my kids' grades? Are they gonna pass? And what school they're gonna get into? Like, we have to also as a community be willing to say, it's okay. Like, it's okay. We just want our kids. Can we end this school with our kids loving school? With you loving teaching, right? So that, can we do that? It doesn't mean we can't, also be highly academic and do that and come back and always do whatever, but can we just spend the spring loving children?
And one small personal note is that, my office is not even meeting in the, with our unit regularly now. And so life has gone on. People have had babies, people, 2 years old, like your kid's walking now. I remember you were pregnant, and so it's like I missed out on the water cooler conversation, right? I missed out on all the joy of going to work. I do like going to work, David. I do like going, but that part has been gone. And so let's go ahead, hopefully when, celebrating that side responsibly.
Yeah.
Lean in.
I do want to, there was a point that I wanted to make sure there. I feel like most of the conversation has addressed some of the questions tonight. I know that someone asked about why not wait till after spring break? So I think that's an important question, at least so that you hear my thinking. CDC guidance went into effect on February 25th, was an important piece through that conversation, but also in conversation with our watch team. Looking at that declining data that was presented, we've got great data that we're seeing in our district. The other 40 districts that I've talked to, those that have gone and those that are thinking of going, those that have seen positive success. They felt that the sooner that they were able to move through it, the sooner they were able to, because of their data, the success that they were seeing. Also following guidance from the city of Bexley and having conversations with Franklin County Public Health, they have supported our timeline and they, like I said, appreciated our conversations. So that's why I recommended the 4th. But I also want to speak to that runway that I spoke about. I do believe effective immediately is important process. And I did that in the after events, after school hours. But I also realized quickly the impact that had on some of our families and some of our staff members. Marguerite talks about that plan over the next 2 days. I think it's critical. And I do believe we will be more prepared on Friday to love, care, and take care of our students than if we went effective immediately. But I also feel that it's okay for us to go for on that Friday. And I also think that gives us an opportunity for our students and staff to see what that is. And for us to adjust, it gives us a few days to process any changes that need to happen so that we're ready for Monday. So I just wanted to acknowledge that piece.
Thank you, Dr. Fine. I think that I know you went through a process to decide what the right date was to propose to the board and that your desire to give some time for folks to process the change in advance of the change. I really thought that was important and I appreciate that. I want to thank you, Dr. Fine, and Dr. Williams, who I know is here, but I don't know where he is. He's hiding back
He's
there.
at the
There he
podium.
is. I know a ton of work went into the process to make this decision, to come up with the exact recommendation, to prepare those slides, to work through and to be ready for this meeting. And it's a ton of work and a lot of care went into it, and I really appreciate it. I want to echo Dr. Williams' recognition of all those in our schools who have done the really hard work, the first responder type work that's gone on in the buildings for all this time. It's been really meaningful. And while I totally agree that this is a time to celebrate, I think a lot has been done to support our students throughout this pandemic. And I really appreciate the work that's been done there. Our community members, I'm very grateful for folks coming in tonight to talk to us. We've got a lot of communication outside of this room as well. This pandemic has been really hard. It's been really hard on our kids. It's been hard on everybody, but we're mostly concerned about our children, and we know that it's been difficult. And I think that I feel very optimistic about where we are. I'm grateful that our community members have been vaccinated. Our community members have worn masks. We've done all of that in order to protect ourselves, to keep our kids in person learning, and to protect others. And in a mask optional environment, I'm really optimistic that people are going to continue to do what needs to be done to support each other. I'm grateful that the proposed resolution specifically notes the district's expectation that everyone will honor individual masking decisions, that no one will be subject to discipline for choosing to voluntarily wear a mask or not wear a mask where the use is neither required nor an exception applies, and that no one will be subject to harassment, intimidation, or bullying for wearing or not wearing a mask. I'm grateful for all the thought that has gone into the accommodations for students and staff who will need them. I know a lot of work has been done to be ready to meet those needs, and I really appreciate it. I think we should probably, Brad, do you mind just clicking on that and opening it up? And if you would just scroll down to the actual part of the resolution where we get to, 1, 2, 3, 4. I just want to make sure that everybody's had a chance to read that. We would be rescinding the existing mask resolution. We would be choosing to adopt no masks required effective March 4th. There's the stuff in there about masks to stay and how we would be following those guidance, test to play, self-isolation, et cetera, as determined by the superintendent, which has, been helpful for us and gives the superintendent the ability to make those calls. And then I think the fourth paragraph is what I was talking about a minute ago. And I think we've all been grateful to, as a board, to make sure that these things are front and center for our community, to see that this is what we are supporting. So with that, are we ready to call the question on this? Is anybody so moved?
Second.
All those in favor, please signify by saying aye.
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 Any opposed? Thank you. That motion carries. If there is no further discussion for this evening, I would entertain a motion to adjourn the meeting.
So move.
Second.
All those in favor, please signify by saying aye.
Aye.
Any opposed? Thank you. Thanks, everybody. I really appreciate it.